Good day, good day, good day, good day, good day. Great Tuesday to you. I want to welcome you to this week's Holistic Life podcast. I am your host, Shelby Frederick, and we are delighted and excited to be back here with you for another time of education, another time of impartation, and just another time of just sharing what we are sharing, continuing on in our mental health awareness series that we are doing. Currently, this month, we are focusing in on PTSD, getting a better understanding of PTSD. Last week, we talked about the different symptoms of PTSD. And on today, we're going to actually take a look at the different types of PTSD. So as we go ahead and we jump right into what we're going to be sharing on today, there are major symptoms. There are major symptoms that are similar across the board, and there are different types of PTSD. And depending upon the type of PTSD that someone has, their symptoms may be more severe or long lasting, or they may require a different type of therapeutic treatment. So, the first one that I want to talk about today is complex PTSD. Complex PTSD. And this PTSD may have become more familiar to the common person, but there is a lesser known variation of PTSD called complex PTSD or CPTSD. And the traditional form of PTSD may emerge after a single traumatic event. For an example, it could be someone that may have had a life-threatening car crash. It could be a person who's lived through a car crash, and they may find themselves afraid of driving. They may avoid getting in the car or driving in traffic, and they may have other symptoms associated with PTSD. And if you were with us on last week, I began to share one of my stories that I had when it came to driving in the snow, the very first car accident that I had, in that just almost like paralyzing fear that I had of driving in the snow because of that one single traumatic event. Now, CPTSD is the result of repeated ongoing traumatic events. Repeated. So those who develop CPTSD may have suffered ongoing childhood abuse, neglect, or they may have repeatedly witnessed violence acted out on someone else. So CPTSD is more often associated with people who experience trauma in their childhood, and it affects the way that a person develops since they're more exposed, since they have been exposed to the trauma during a highly developmental time in their life. Now, this term is not in the DSM-5, but it is a term that mental health workers use to help to describe the difference between someone who has experienced a single traumatic event and one that has experienced chronic trauma, especially in childhood. The symptoms of CPTSD are similar to PTSD, but they also include additional behavioral differences. And Dr. Tracy Marks explains it in this way: the early childhood trauma shapes your development and your personality. It's like you have a fractured self, and people suffering from this can spend years trying to mend a fracture. So, unlike a person with PTSD who may be checking locks or, having flashbacks and refusing to drive or jumping every time they hear a loud noise, those with CPTSD have more behavioral things like relationship difficulties, poor self esteem, anger problems, and mood instability. She also went on to say that the person with CPTSD can develop depression or anxiety which is secondary to these problems, but at the core is the issue of this fractured self that came from a serious emotional disruption during the formative years. Now, some additional symptoms associated with CPTSD is a negative self view. So, those with CPTSD may think very poorly of themselves or may carry ongoing feelings of guilt. They may have trouble controlling or regulating their emotions. They may have what's considered an explosive temper, and they are given easily to sadness or even have feelings of depression or suicidal thoughts. There could be difficulty in developing or maintaining relationships. So, those with complex CPTSD often have trouble trusting others and will avoid starting relationship with others. There's also feelings of distrust. So, in general, people with common PTSD may have a significant trust issue towards the world and other people. There's also dissociative symptoms where they are disconnected thoughts, memories, actions, and identity. It's a brain's defense mechanism that tries to escape reality. And this is what is basically happening. So some people with dissociative disorders, they develop alternative identities, but they may also suffer from amnesia. People with dissociative symptoms may struggle with concentration or they may disconnect from the world around them. So, therapy can help people diagnosed with CPTSD, but it's usually a longer process and takes more effort from a therapist and patient to undo the damage that was done in childhood. So, when we talk about post traumatic stress or PTS, this is actually not a type of PTSD, but it could be a precursor for it. When people experience a traumatic event, it's normally to be affected. They're normally to be affected by it. And those with PTS, they experience many of the same symptoms as PTSD, such as avoidance or nightmares. Now, the difference between those who suffer from PTS and those from PTSD is that those symptoms they're less severe and they happen for shorter periods of time. People with PTSD will continue showing those symptoms for longer periods of time and with greater intensity. Now, according to Dr. James Bender of the Deployment Health Clinical Center, PTS is common, normal, and often adaptive responses to experiencing a traumatic or a stressful event. Common occurrences like car accidents can trigger PTS, as well as more unusual events like military combat or in cases of kidnapping. Almost everyone who experiences a scary situation will show at least a few signs of post traumatic stress. Dr. Bender went on to say that the symptoms from PTS will subside after a few days and they won't interfere with a person's life in any meaningful way. So the traumatic event may make them more careful in the future, but it won't stop them from living their life normally. Now, we also have what we call comorbid PTSD. And those with comorbid PTSD are people who have both PTSD and another mental disorder. In this case, someone may have PTSD and depression or PTSD and generalized anxiety disorder. So, anxiety, depression, substance abuse, and are there, those are basically the most common types of comorbidity with PTSD. And it is estimated that as much as 80% of people with PTSD actually have another co occurring psychiatric disability. Now, let's take a look at PTSD and risky behavior. PTSD and risky behavior. People with PTSD are more likely to engage in risky or destructive behavior. So, if PTSD is triggered by trauma, doing something that might lead to additional trauma is difficult to understand. It's very difficult to understand. And it's a common belief that people with PTSD turn to these behaviors as a way to escape the symptoms of PTSD, especially intrusion. So, those who use drugs or alcohol may be using them as a coping mechanism to help them avoid thinking about the original trauma. It may also be a way to assuage the guilt or the shame that is associated with the trauma. So, what are the types of risky behavior? These could be gambling, drinking, drunk driving, aggression, drugs, unsafe sex with strangers, extreme sports without regard for self protection. The self destructive behavior may diminish the symptoms of PTSD momentarily, but ultimately, the stress of these choices it prolongs the PTSD symptoms and it actually makes the disorder worse. Dr. Naomi Seda, an assistant professor at the National Center of Boston VA at Boston University, it says that individuals with PTSD exposure to new stressful events will often prolong their symptoms and can make them worse. So, these findings suggest that treatment providers should ask trauma exposed veterans about reckless behavior to make sure that they are not engaging in harmful behaviors that could make their PTSD symptoms worse. So, when it comes to treating PTSD, a therapist will try to address any risky behaviors that the patient may be engaging in to help reduce the risk of continued trauma. Continued trauma. Now, when we look at PTSD and relationships, it's no secret that PTSD can strain relationships, particularly with a spouse or a partner. There have been many cases of strong marriages unable to withstand the effects of severe PTSD. And even though, both members may want to maintain the relationship, there are times when people they're just unable to resolve the inherent issues with PTSD. Now, in 2019, Megan Drillinger wrote a piece for Healthline called Six Things I Learned from Dating Someone with PTSD. And in the article, she began to explain how for 3 years she was in a relationship with a man who had experienced PTSD symptoms daily. And her ex, he was a decorated combat veteran. He served in Afghanistan 3 times, but the toll that it took on his soul was heartbreaking. And she went on to say that being a partner of someone who has PTSD can be very challenging and frustrating for many reasons. And you may want to take away the pain, but you're also dealing with your own guilt at needing to care for yourself. So you want to have all of the answers, but you often have to come to grips with the reality that this is a condition that can't be loved out of someone. And so what we want to do when we're talking about, PTSD and relationships, we want to look at some of the things that you can do to support loved ones with PTSD. It is extremely important to know that supporting someone with PTSD does not mean that you are responsible for making them better. That's not what that means. If you have a relationship with someone who has PTSD, you can't heal them with support. You can make the road easier for them, but your loved one should seek professional help to give them the tools needed to help them with their disorder. So, with that said, There are some things that you can do that might help to ease the burden and lessen the strain in your relationship. Number one is to understand that PTSD is real. And perhaps one of the first steps in helping someone with PTSD is acknowledging that this is a real disorder that produces real symptoms. And though mental disorders are difficult to understand or difficult to relate to, that, for those who are not experiencing them, to people with the disorder, it is very real and is very debilitating. Very debilitating. Number two, you want to give them room not to talk. Talking about a traumatic event might help someone who has PTSD, but that doesn't mean that they're always willing or able to discuss the details of their trauma. Their resistance to talking about the traumatic event is not a sign of being unloving or untrusting. It's more likely because they want to avoid thinking about the event. So, bringing it up often is more likely to cause them to pull away and to become uncommunicative. They're just not going to want to communicate. So you want to gently encourage them to talk about it when it seems appropriate, but allow them to be the one to discuss it when they're ready. It's very important. Number three, work with a routine. A routine is a good way to help establish order in your home for a person with PTSD. And doing this can give a person with PTSD a sense of security and stability and provide comfort in a world that already feels chaotic and out of control. So the schedule that you use will be different than someone else's, but it may also include exercise, meditation, prayer, planned meal times, and also daily chores. And so notice I did say prayer. I'm not leaving out the power of prayer. Now, number four, you want to learn more about PTSD. So educating yourself on PTSD will be one of your biggest strengths for helping a loved one and yourself cope with the reality. You can do this by reading, you can watch videos, you can talk with other people who have had PTSD, or you can even discuss it with a therapist. Number five, understand that caregiver burden is real. People taking care of someone struggling mentally or physically can be extremely stressful and draining. In a study that was published in part by the National Institute of Health, the author explains that unlike professional caregivers such as physicians and nurses, informal caregivers such as family members or friends, those that provide care to individuals with a variety of conditions, including advanced age, dementia, and cancer. This experience is commonly perceived as a chronic stressor, and caregivers often experience the negative psychological, behavioral, and physiological effects on their daily lives and health. Now, although the study was specifically talking about people taking care of loved ones with cancer um, or advanced age, the sentiment is the same for general non professional caregivers. Long term care of a person can lead to secondary issues and can be a burden for them as well. So, to lighten the load, if you're a caregiver, it's a good time for you to take care of yourself. Every moment of every day can't be consumed with PTSD. Take time to do things that you love and enjoy. Another good solution is to find a support group for those who are also caring for loved ones with PTSD. Finding a community of people dealing with the same thing can help you manage your own feelings and concern. In addition, seek loved ones in your life and allow them to be a part of your greater support network. And most importantly, seek professional treatment. Seeking outside help is essential for helping you and your loved one to cope with PTSD. And although some may feel that there's the stigma with working with professional help, this viewpoint is becoming less common as people open up about mental health issues across the board. So there is no shame in seeking professional help. If you're living with or helping care for someone with PTSD, it is often beneficial to seek therapy as well. Therapy as well. So I'm going to stop here for today. I don't want to get into the treatment for PTSD. We will jump into that one next week. But I just, wanted to share this, and especially this piece, about just some of the things that we may um, experience with loved ones that we just may not understand. Again, getting an education or educating ourselves about these different topics allows us and gives us better, not only just insight, but it allows us a better opportunity to be able to walk alongside them while they are experiencing any type of crisis, and then to be the best help and support that we can be. Sometimes in our doing good, we can cause more harm, and we don't want to do that. So I thank you for tuning in to today's podcast. Again, we're going to be here on Tuesdays at 11 o'clock a.m. Eastern Standard Time. Before we close out for today, I just want to make a couple of quick announcements that if you are in the state of Ohio, we do have our Youth Empowerment Mentorship Program. Our list is open. We're going to be working with the ages 6 to 18. We have various programs that we are rolling out for the 2022-2023 school year. If you would like more information, if you are on your desktop, you can definitely scan the QR code that is there. If you are in the state of Ohio, we can help you to walk you through the process of getting to see if you are eligible for the ACE program. And last but not least, we have our hardcover journals that are available exclusively on Amazon. And our last cohort for the year for our certified faith-based clinical counselor training is coming up in September, October, and November. Our final classes for that we will be having for the year. The registration is open. So for our October, November, and December class, October, November, and December, I have added some Saturday sessions. So all of that information is on the website. I will be sure to post that in the comments, where those of you that are interested, those of you that have been asking if I had additional days other than Wednesdays. Yes, we are coming with our Saturday intensives. That will be in September, October, and November. I will pop the link on in the chat after this broadcast is over, so that you can get the information. And if it's something that you are feeling led to do, you can join us. So again, thank you for tuning into this week's Holistic Life podcast. I am your host, Shelby Frederick, also known as Lady Jules. I am a certified faith-based clinical counselor and instructor. Delighted, excited that you spent a few moments of your time to be here with me as we continue on in our study on this month, Understanding PTSD series. Blessings to you, and we'll see you next week. Bye-bye.